This is a CJSN podcast, and I am Dr. Gangadharan Komala from the University of Sydney. I will present the findings of our study on the kidney adverse effects of immune checkpoint inhibitors. Immune checkpoint inhibitors have revolutionized the treatment landscape for patients with cancer. However, they are also associated with adverse effects in different organ systems, including kidneys. We wanted to explore the incidence of different aspects of kidney adverse events associated with different categories of checkpoint inhibitors in comparison with placebo or standard chemotherapy. We reviewed the data from 95 randomized controlled trials involving 63,973 participants, making this one of the largest studies on severe kidney adverse events with checkpoint inhibitor therapy. The overall incidence of acute kidney injury was 1.4%. We identified that the risk of developing acute kidney injury and composite of acute kidney events was higher in patients receiving inhibitors blocking programmed cell death 1 or PD-1 and programmed cell death ligand 1 or PDL1 in combination with chemotherapy when compared to placebo or standard chemotherapy. The incidence of hypertension was lower among patients receiving combination therapy involving anti-cytotoxic T lymphocyte antigen 4 or CTLA4 inhibitors. There was no increase in the incidence of chronic kidney disease with checkpoint inhibitor therapy. This study highlights that the incidence of severe acute kidney adverse events, albeit present, is not high and is similar to other studies published in this area. The risk of severe acute kidney adverse events is higher with PD-1 and PDL1 therapy in combination with chemotherapy. Our study findings, while similar to findings from other observational studies, are different from another meta-analysis published previously, possibly due to differences in study inclusion criteria. Some of the kidney adverse effects could possibly be due to the expression of PD-1 and PDL1 among different cells in the kidney. This study provides an insight into the risk associated with specific categories of checkpoint inhibitor therapy. Patients receiving combination therapy could be monitored with a urine dipstick and kidney function test as a simple way to monitor and screen for kidney dysfunction in the oncology clinic. Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.